I think we'll start with just a very brief round of introductions. So we're going to start with our wonderful student presenters. If you just want to say your name, the university you're with, and the profession that you're studying. And we'll start with you, and then we'll introduce the judges in the same way. So I'll start. Why don't we start with Lynette?
Okay. I'm gonna apologize in advance. I have a little bit of laryngitis. So if you cannot hear me, please let me know. My name is Lynette Waddell. I attend the University of Minnesota. I am at I am taking the master's program as a dental hygienist, and I am licensed as a dental hygienist.
Great. How about Priya?
I'm Priya Perikarpan, and I'm at the U of M Twin Cities, and I study pharmacy.
Great. And Lamia?
Hi, my name is Lamia. I currently attend H.E. Still University in Missouri, and I'm a second-year dental student.
Great. And Madeline?
Hi, my name is Madeline Nones. I attend the University of Minnesota, and I'm in my final year of my MPH in epidemiology.
And I see your coach, Todd? Or James?
Yes. Yeah, first name Todd, last name James.
Yeah.
I'm a physician for older adults, and I'm at University of California, San Francisco.
Great. Well, welcome all of you. And we'll start with our judges. How about if we start with John?
So I'm John Morley. I'm a geriatrician at St. Louis University. I started out my faculty position at the University of Minnesota as an endocrinologist. That was before any of you were born. That most probably includes the judges as well.
Welcome, John. And how about Jim? Go next.
Hi, everybody. Jim Pacala. I'm a geriatrician at the University of Minnesota.
And how about Joe?
Hi, everyone. I'm Joe Gogler. I'm a professor in the School of Public Health at the University of Minnesota.
Great. And Marla?
Marla Bergwager. I'm a faculty in the School of Social Work at St. Louis University, and I direct the Geriatric Education Center in the medical school.
Great. And Max?
Max Zubatsky. I'm program director of medical family therapy in St. Louis University, and also an alum of University of Minnesota's MFT program.
Great. And I'm Chris Talley. I'm in the School of Nursing at the University of Minnesota, and I'm a geriatric nurse practitioner as well. And just so you know, we have Sarah Engstrom on. She's our technical support person, so we're welcome to have her. And just so you know, we are recording the session. And with that, I will let the students have the floor.
All right, so I'm going to be the person presenting. So I'm going to go ahead and share my screen. All right, so can everybody see the presentation?
Yes, we can.
Okay, perfect.
Put it on slide mode. You've got the stuff on the side as well.
Oh, yes, I'm going to put it in present mode. So I guess I will have my teammates just tell me when to advance the slide. All right.
Okay, so, oh, actually. Okay, sorry, technical difficulties. So the patient that we are going to be working with is named Camila Lopez. And in this presentation, we're going to summarize background about the patient as well as her concerns. We're going to discuss various patient-centered goals and include how various healthcare professionals can and should work together to provide the best possible care for her. Next slide.
We would like to introduce our patient, Camila Lopez. Ms. Lopez is a 75-year-old widowed Latina female. She speaks and writes in Spanish with limited English knowledge. She is undocumented. Ms. Lopez lives in an agriculture community close to her son. The closest access to care is 25 minutes away and is a federally qualified health center. She has limited her access to family and friends because of the illness SARS-CoV-2, commonly known as COVID-19. Her core values are her family, independence, and has worked as a part-time cleaner. Ms. Lopez's preference is not to go in for medical treatment unless prompted by family members. She has lingering effects of COVID-19, healthcare barriers, including language and financial. She has not visited her son or daughter and grandchildren based on fear of giving them COVID-19, which she had 3 months ago. Her symptoms are fatigue, headaches, body aches, weaknesses, cognition, forgetfulness, bad breath, metal taste, which may all be considered part of long COVID, the long-term effects of having COVID-19. Next.
So based on the provided medical history and lab values for Ms. Lopez, these are the current medical conditions that we determined. Of note, her existing diagnoses for type 2 diabetes and hypertension do appear to be uncontrolled. Some of her long-term COVID complications include brain fog, fatigue, loss of taste and smell, shortness of breath. Though we have anemia listed on here, it's not an official diagnosis and would require further evaluation by the medical team. There may also be some multifactorial geriatric syndromes related to aging that are occurring that put Ms. Lopez below baseline functional status. And this could be the slower gait, weakness, and mobility limitations, and these should also be further evaluated. Next slide.
All right, so now we're going to discuss the family dynamics a little bit. So the patient, Ms. Lopez, moved to the United States about 5 years ago. She had been living in Mexico with her husband, who unfortunately passed away from a heart attack. After his passing, Ms. Lopez's family recommended she move to the United States to be closer with her immediate family members. She currently lives in a small, rural town near her son, Mateo. Mateo works in a meat processing facility and was deemed an essential worker during the pandemic. This means that he had to continue working at the facility and had a higher risk of contracting COVID-19. He feels guilty about the transmission of COVID-19 to his mother, which resulted from his place of work. Mateo's wife, Amelia, works part-time at a restaurant and has a relatively close relationship with Ms. Lopez. She is available to assist with Ms. Lopez's health when Amelia isn't at work. Additionally, Amelia and Mateo have 3 grandchildren who Ms. Lopez loves dearly. Prior to getting COVID-19, Ms. Lopez spent time cooking for her grandchildren and helped to care for them when both parents were away. In addition to Mateo, Ms. Lopez also has a daughter who works as a registered nurse. Unfortunately, she lives 3 hours away. She also is married and has 2 children. However, Ms. Lopez hasn't spent much time with the family after contracting COVID-19. She misses them and really hopes that her healthcare intervention will assist in removing the barriers that are currently keeping her from quality family time. Now I'm going to move on to talking a little bit about COVID-19 in immigrant populations. The COVID-19 pandemic has not affected all individuals equally, and our patient, Ms. Lopez, was no exception to these inequalities. We are all too aware of the spread of misinformation and disinformation around both the virus and the COVID-19 vaccine. Unfortunately, misinformation has spread within non-English speaking populations where there is less access to healthcare and correction for this misinformation. Inadequate healthcare access and stigmatization around immigration status also create barriers both to vaccination and proper treatment of COVID-19. As a result, unequal transmission of the virus has persisted throughout the pandemic, and the Latinx population has experienced a disproportionate number of COVID-19 infections and also hospitalizations. This is further compounded by socioeconomic factors, which place a disproportionate number of Latinx individuals below the poverty line and working as essential workers. Of course, minority individuals face stigma in healthcare facilities, and they aren't always provided the best healthcare for their illnesses. However, in regard to the COVID-19 pandemic, factors outside of just hospital bias play a larger role in health disparities for the Latinx community. These individuals often present to the hospital at a later stage due to inadequate access to preventative care. As a result, Latinx individuals in some areas of the country are more likely to be hospitalized and more likely to die from COVID-19 compared to their white counterparts. Luckily, Ms. Lopez did not need to be hospitalized for her COVID-19 infection. However, she still didn't receive the care that she needed, and she is still struggling with lingering COVID-19 symptoms. Going forward with Ms. Lopez's care, an interprofessional team can help to mitigate different forms of systemic racism. For example, the use of an interpreter or a Spanish-speaking social worker can help to overcome the language barrier and ensure patient needs are met. Also, including community health workers on the care team can ensure that community resources are utilized that account for cultural differences in care between white and Latinx populations. And they'll also be more familiar with how to overcome financial barriers faced by immigrant communities.
So there are 4 patient-centered goals we would like to focus on when it comes to taking care of Ms. Lopez. These include reducing her fatigue, getting her back to work, seeing her family once again, as well as finding joy in daily activities, which is very difficult from her lingering effects of COVID-19 that we touched on. When discussing patient-centered goals, it's really important to remain ethical and focus on what the patient's desires and goals are. So we will briefly go into each goal and discuss how we, as various healthcare professionals, will work together to complete each task. Next slide.
So our first goal was to reduce fatigue, and our team seeks to do this with a multifaceted approach. The social worker, who is bilingual and also immigrant focused, will act as the care team manager and help Ms. Lopez navigate access to healthcare and also financial resources. Currently, Ms. Lopez does not have a primary care provider, but we would like to get her set up with one, or at least get her set up with a doctor at the community health clinic to help work with the pharmacy team to optimize her medications and monitor her conditions, as well as managing her conditions. Also, her medical primary care team can help assess her long-term COVID symptoms, as well as monitor her geriatric syndromes and general aging processes in general. The medicine team would also check her eyes for retinopathy, which can be associated with type 2 diabetics, and making sure her vision is okay will help improve safety and reduce curveball risk. It would be important to provide patient education regarding her treatments and conditions so that Ms. Lopez can better understand how some of these changes can help her, even though they may seem like a burden. After initiating treatment, it will be important to follow up with Ms. Lopez. This is where the community healthcare worker and also her family can really be a lot of help. The community healthcare worker can provide at-home visits to ensure medication adherence and also help fill her pill boxes to improve safety. Her family can help coordinate appointments and help her stay on track with her plan of care. Both can help with home monitoring of her conditions so that Ms. Lopez doesn't have to go into the clinic to have routine measurements such as blood pressure, glucose, and cholesterol. Furthermore, a lot of these visits with her providers at the clinic can be conducted via telehealth if possible, and this would also help improve convenience for Ms. Lopez. Next slide, please. In order to reduce Ms. Lopez's fatigue, we will use a medication therapy management pharmacist working with her doctor to help optimize her medications. Some suggestions we have are adding medications to better control her hypertension, hyperlipidemia, and diabetes. We would work with her primary care provider to evaluate her potential anemia using additional tests. If deemed necessary, we would then add an iron supplement, which could potentially help reduce her anemia, which is often a source of fatigue. These medications would be dispensed at the community health clinic using the same sliding scale agreement that Ms. Lopez currently uses. The pharmacist can help educate on the importance of taking medications as directed and could coordinate with the community healthcare worker to help fill pill boxes and also make a pill calendar with examples of each pill to help reduce potential medication errors. So these changes to her medications do not all have to occur at once and can be implemented gradually to allow time to build trust with Ms. Lopez and also have time for education. In fact, they should be implemented gradually to also minimize side effects, such as potential postural hypertension, which she may already be experiencing a little bit of. By making these changes, we hope to improve Ms. Lopez's overall health and quality of life by addressing the conditions which are likely contributing to her fatigue. Next slide, please.